Hey everyone, welcome back to another episode of the Inspired by Her podcast. I'm Kay, and today I'm here with a special guest, Jasmine.
Hi, everybody.
All right, you can introduce yourself and then let them know who you are.
Okay. Well, I am Jasmine Jarrett. I am a board-certified family nurse practitioner. I currently work in primary care. I am in a leadership role, so I supervise the other nurse practitioners and doctors that are at two of our Louisville clinics, one in Jeffersonville, Indiana, and one in Louisville, Kentucky.
All right, so supervising. Oh my God, that's like a switch. You went from like being the one like on the floor to like supervising. How is that?
I still get out in the field.
Yes.
So that's good. But it is really different. If you would have asked me a year ago, I would have never thought I'd be in any kind of supervisory role, but it's been really good. Just having like clinical oversight. And I still learn a lot from my staff too. So
Yeah.
I'm only 2 years in the game. So,
Oh wait, that's a long time actually.
yeah, I guess. But yeah, it's good. I'm still learning a lot in leadership, and it's helping me grow as a person. So I really
Yeah.
enjoy that.
Are you still like in the phase of like questioning yourself? You know, when you come into something new and it's like you're not always for sure of yourself, or sometimes you are, but then you question it if this is the right thing. Do you deal with that being in like supervising everyone else?
Absolutely, especially because a lot of the people I supervise have more experience than me. But I think as a provider, just in general, any person in healthcare, I think it's healthy to question yourself. I think that the most dangerous healthcare providers are the ones who think they know everything. So
Right. Like that.
I'm a lifelong learner, and I tell my staff all the time, like, I am learning from you as you are learning from me. So I think it's healthy to question yourself. Yeah.
Got it. Okay, so for this episode, I was hoping to get a lot of aspiring nurses and nursing students to tune in. So with you being being a supervisor, if any of them students want to go into leadership, what would you tell them?
That's a good question. Okay, Kay. I would tell them, as far as going into leadership, get a mentor. Reason being is because it's hard to navigate the professional world as it is just doing like your normal job, but then also having to make sure that you maintain emotional intelligence when situations get hard, as well as learning how to professionally convey certain things while still balancing, being compassionate, as well as being stern. That has been a hard balance. But if you have a mentor that has been in those positions, has been in those rooms, especially if you're a person of color, it would be good to have a mentor that is a person of color, because oftentimes you're the only person of color in that space. So I would just say getting a mentor to help you navigate those things. If I didn't have my older sister is a chief nursing officer, and so she's been in a lot of the spaces that I am now occupying, and it's really important that I get to talk to her when I go through certain situations, because she may have been through that, and so she just helps me navigate through that. So I'd say get a mentor or someone who's been in those spaces before.
All right, okay. So did you see a difference in work-life balance when you switched to this role?
Yes.
You did.
So, just as I told you before we started filming, I'm kind of always on call.
Yeah.
My staff, we work, my offices are open 7 days a week. So we have staff on the weekends too. And so like it's a weekend right now. So like at any point they can call me and need something. So that's been a little bit of an adjustment, and not in a bad way. Like I love that, they feel comfortable reaching out to me. But yeah, it does take up just a little bit more of your time when there are people depending on you and they may have questions at any time of the day or night. So
Yeah. How do you stand on firmness and like get comfortable in saying no? Because when you're like a person of like leadership, it's people would always bring you what they think you should be doing different, or why what you're doing isn't working for them. How do you stand in your decisions?
Usually, if there's something that someone asks of me and I have to say no, usually there's a policy to back it up. for me to pull and say, like, these are the reasons. I think my big thing is just like making sure that if I do have to be stern in something, they know the reason, so that it doesn't look like because we said so, or, you know, because we don't want to. Really, it usually comes down to like, because we can't, because here's why we can't. Or, you know, if it's something that doesn't necessarily have a policy, I guess we walk through like, if we do this, these are the negative consequences to this. And so this is why we can't do that, you know, that way. So I think it's either pulling a policy or just like making sure that I explain the reason why. So then it comes full circle for all of us and we're all on the same page.
Yeah. Are you good at incorporating self-care into your life, with you being like, you have so many roles in your life to where you're the call-on person. You're a mom, a wife. How are you incorporating self-care? And if you aren't, why do you think like you haven't gotten there yet?
I'm really bad about self-care. I guess it just depends on what you classify as self-care.
Not even just like nails and going out.
Yeah.
Sometimes self-care is rest. Sometimes it's self-care like, oh my God, I spend every day at home yelling at kids and cleaning up. I want to watch a show.
Yeah,
you know?
I will say that I'm not really good at it. I'm still trying to figure that out. But what I do often is probably like at least once every 2-3 months, I take a trip. And even if it's just like a little weekend trip, and then sometimes it is with my family. A lot of times it is with my family. I usually don't take solo trips, but just getting away, switching up the scene,
right?
That's good for me. But as far as rest, I'm still trying to figure that out, honey. I have no idea. I don't know. I don't have an answer. I do not rest often. So.
Okay, so I'm 23. So I started off like home health, then traveling to different facilities as a nursing assistant, and then medical assistant. So I'm spending like 2 years at most in like each role before I progress to something different. You've been in supervising for 2 years. 2 years for me seems like a long time and like a quick and boom, easy burnout, because it's like you're doing it every day for 12 hours. How do you prevent burnout being in this field for so long?
So actually, I would say my trajectory has been similar to what you're saying, like yours is. So like I spent, you know, like 4 years as a CNA, and then I went and I became a nurse. So then I spent like 5 years as a nurse. In each like year or two as a nurse, I went to different specialties. I like stayed PRN for the most part with labor and delivery. That was like my main thing. But like I switched it up. As a nurse or as a CNA, you can do anything, or a medical assistant, you can do anything. You have it's, you know, fluid. So I did like switch up where I worked a lot. So that helped me like stay into it. And like I said, I'm a lifelong learner. So it just helped me like, I don't know, the switch up is really nice so you don't get burnt out. Because, you know, with the switch up, there's different schedules. Home health schedule looks very different from hospital schedule or nursing home schedule. So it's nice to have that switch up. And then like now as a nurse practitioner, so I'm 2 years as a nurse practitioner, but only 10 months in the game as in a supervisory role. So as a nurse practitioner, I've done like women's health, and then I've done like an urgent care alternative, retail medicine, and then now in primary care. And so this is June will make my second year in primary care. So I think I have the same trajectory as you. It's just
I
switching
feel
it
like
up.
That's going to be me. I have coworkers who's been in like one place for like 15 years. And I'm like, how do y'all do it? You go through so many staffing shortages. If you've seen so many employees come out, you've seen this place in hell, you've seen this place in heaven. How did you stick around so long? I'm like, I don't think I will ever be that person.
Yeah.
I don't know.
I watched my mom have the same job for 30 years. She's a nurse. She's an LPN. And I watched her work at the same nursing home for 30 years. And she went through all of these things. And now the place is closed down, so she doesn't work there anymore. But like now she's addicted to switching it up. And it's just like, not that I can't provide loyalty to a company. That's not what I mean. But like switching up my role. And like my role now, like I said, sometimes I still get out in the field. I'm still seeing patients when I need to. And then also I bounce back and forth between both clinics. Just to like be there for my staff, and I do different things. I help out different things. So I guess like my role is like interesting because I don't do the same thing every single day.
Yeah.
So finding something that I guess has a balance where you're not in the like mundane, like every single day doing the same thing. Yeah.
So what's interesting is I was going to ask you, like, how did you get here? I like to ask every guest, like, how did you end up where you are? And then you say your sister and your mom is in nursing.
Mm-hmm.
Wow. So was that like the influence for like you getting into nursing? How did you get there?
Yeah, it was a big influence. So like on my mother's side, so my grandmother, she was a nurse, and yeah, she just passed away within the last year and a half. So rest in peace.
Sorry about that.
But yeah, she was a nurse. And so like my aunt is a nurse, my mom is a nurse, my sister is a nurse. It's just like, I feel like, you know, it's just our caring nature. We got that from my grandmother. And she was very proud of the nurse that she was. And she did different things too, all over the country and even over in Africa. So
Really?
yeah, it was like very
Wow.
inspiring to like hear my grandmother's stories. And then, like I said, with my mom, just seeing her like be out there every day and be really caring for her residents. She's mostly in like geriatric care. So anyway, that was inspiring. But I went to Central High School. Woo-hoo.
Me too.
Yes, I know. So I did the nursing program there. And then, you know, they have the CNA program. So when I was 16, I did the test and became a CNA. And I remember I told my sister, she was like, so you want to be a nurse? And I was like, yeah. And she was like, don't. She's like, be a doctor. And I was like, I don't want to be. So anyway, after nursing school, or after that, I went to nursing school at U of L. And then I went straight out of nursing school and went straight into labor and delivery. And like I said, I switched it up a little bit, did different things. I did home health. I did pediatric psych. I was a clinical instructor for 2 major universities in our area. So yeah, just switched it up a little bit. And then like, I did get burnt out on floor nursing after a while. Labor and delivery, even though it's super exciting, you're a mom, so you know how it was, you know, giving birth.
Yeah.
But it's either the best day of a woman's life or it's the absolute worst, because you see the other side too when, you know, people, you know, babies pass away. And it just got really hard for me. So I started trying to figure out, what do I want to do next? And I remember my sister's like, be a doctor. And I was like, I don't want to do that. I'm not going to medical school. But nurse practitioner was a happy medium. So going back to nurse practitioner, or going back to the master's program and getting that. And then, yeah, I guess I've already explained.
Yeah. So you go back and you get the master's. At that point, you had Jackson already, right?
Yes. Mm-hmm.
And then your daughter. Mm-hmm. So how do you do that? Because how old are they when you go back for the master's anyway?
Ooh, Jackson was like 2 or 3. Lord. Yeah. And then Brooklyn was, she's 12 now. So she was, when I started in 2019, she had to have been like 9 or 10, 8 or 9. Yeah.
So for anybody watching this, you know, like often when you go back to school, it's always that one person who's older and they're like, I'm too old to be here, or I couldn't do it, or I got this many kids. If it's somebody that's watching that wants to and they're not, because they're using these reasons as their reasons, take them through like your journey. Why you didn't let that stop you, how you managed it, like day to day, just a little bit for them.
Yeah. So how I manage it is honestly utilizing my support system. I have a great support system. My mother-in-law and my mom and my grandparents I told them my plan. Like, I want to go back to school. These are my dreams. These are my goals. And, you know, they figured out how they could help me get there. My husband was super supportive too. So I think like I really just leaned on my support system to, you know, if I had clinical, they helped out picking up the kids from wherever or taking them to and from their sports stuff. And then like me and my husband, most of the time we had an opposite schedule, which was really hard for our marriage, but like we did what we had to do to like get to, you know, the next phase in our lives. So I would just say whatever resources you have, utilize them. I did the same thing because I was a single mom in the nursing program first. And I utilized every resource I had, anything that I qualified for that could help me get through this phase so that I could have a better life for my daughter. I utilized it. I was on all kinds of government assistance. So I just say whatever you can utilize that's out there for you to be able to accomplish your dreams, just do it. And I always tell people the time is going to pass anyway. So how you spend that time is up to you.
Yeah, it's true. So recently, you made a post, you were talking about labor and delivery. And if you've made a post like that before saying how like you're more so happy as an MP and how you wouldn't go back to like floor nursing. For people who's about to graduate and get on the floor, let them know like what was your day-to-day life in like labor and delivery? What was that specialty like?
So, coming in every day, you had to be there at 6:30 or 6:45. I can't remember, but usually you're either going to be in one of three spots. You're going to either be on the antepartum unit, which antepartum is almost like a med-surg unit, but for pregnant women. So women who have like conditions that need to be managed in the hospital while they're pregnant, like diabetes, or they are at risk for preterm labor, so they have to be in the hospital because the risk of the baby being born early. Or you're going to be actually on the labor and delivery unit taking care of a laboring mom. I guess 4 places. You're either going to be in the OBED, which is like our own specialized obstetric emergency department for people who come in possibly in labor. That's where we assess them and determine if they're going to go either to antepartum or if they're going to go on the labor and delivery floor. And then there's the OR. So that's where we have like scheduled C-sections or unscheduled like emergency C-sections. Okay. So you get assigned one of those places. And then say if I was going to be for a laboring mom, you go in, you get report at the bedside with the laboring mom, usually if they're not asleep. If they're asleep, you do it outside of the door because laboring moms don't get much sleep. Right. So, you get report and then it's up to the baby and the mom how the rest of the day goes. Usually you would do, 1 to 2 deliveries a day. Everything is fine on labor and delivery until it's not. So if, you could be laboring or you could be pushing with the mom and the baby's heart rate tanks and you have to immediately go back to the OR and it's quick. Everything has to be changed. There's tubing that has to be changed. There's different equipment that has to be changed because it's very different, and depending on what the situation is, the mom either has to be put asleep or they have to do a spinal block or something. So it just depends on the situation. So it could get really intense really fast. And so you were always kind of like in a fight or flight mode.
Right.
Yeah. So, or you have situations where the baby has already died in utero and they assign you to that, but usually they would try to assign you only to that person. So that way you're not bouncing back and forth between being happy with the mom who's laboring and then going into the other room with the mom or the mom and dad or whatever, who's sad. So that's called intrauterine fetal demise, or IUFD. So if you had an IUFD, usually, you had a really tough day because you were trying to comfort a family who has lost their baby and still has to deliver the baby one way or another. So that was hard.
Outside of labor and delivery, did you ever do like med surg or anything?
No, labor and delivery and antepartum are the only 2 things I did in a hospital setting. I did work in a different hospital, but it was an office inside the hospital. It was wound care, so that's totally different.
Well, okay. Yeah. So how did that influence you moving into other parts of women's health?
I have just innately always loved women's reproductive and sexual health. And I don't really know. I had a baby as a teenager, and I remember being in the hospital when I had my daughter and just like, man, this is something I really want to do. I really love women. I love educating women on things because I feel like a lot of us young girls, especially my generation, like our parents didn't talk to us about sex, or it was kind of like a taboo topic. So your first interactions or your first like learning about sex was either at school or from a boy that you liked,
Or I feel like with that, I thought back after I got in the field, like, was our healthcare class really like in depth as it should? And I don't think it was. I think because we had a male that taught it for one. And, when they touch on certain stuff with us being in middle school, it's a giggling moment when you say certain words or bring up certain topics. So it's not like really taken seriously. And that's one thing I always say when people ask, like, what would you want to do? I feel like I would want to go into the schools. Like, how we would always have events where people come in and talk to us about stuff, which is not always taken serious by the kids. This is just a loud-ass auditorium. Right. But I feel like it does need to be taken into schools because, I don't know, like my time working in immediate care, you see, like, so many teenagers. And oftentimes they're like repeat people.
Yep.
You know?
Yep.
And then like you have people there who like might understand them and sympathize with them, or like people who don't, you know? Like I feel like I like try to advocate for that a lot at work.
Yeah.
Like when you come into that setting, like the waiting rooms are always quiet as hell. And it's like everyone's not coming in for like a COVID or a flu shot or like, you know, stuff like that. And so one problem is like sometimes like at these front desks, like we had something like this in class yesterday. We would go over like HIPAA cases and like talk about why it shocked us.
Yeah.
And it was like, I think someone up front was talking to the person about like the procedure of like getting HIV testing and stuff. And so I'm like, that's often like a real life problem to where like I've brought people back to triage them and they're like, yeah, that lady up front, she was asking me my symptoms all out loud and stuff like that. And I'm like, we have to be careful with that because like everyone's not here for just like a wound or a laceration, you know?
Yeah.
And like, I don't know, that's just one of the things that like I would want to do a career day at a school about, like bring a bunch of like practitioners in to talk to these girls and stuff.
Well, hit me up if you do. I would love to.
Like,
yeah.
just incorporating, like I remember I had a dad had brought his son in, and I thought it was the best thing ever because oftentimes they don't come in with their parents when they do come for like testing or something, or they come on their own or something, or like just even incorporating the importance of like blood draws. It's like you would have like even grown men, they'll come in, want testing, and they only want the urine part because they're afraid of the blood draw. But it's like,
or they don't know the difference. They think you can test HIV from their urine.
Yeah.
And so it's stuff like that, that, and I see so much of the like lack of knowledge, especially in our Black community. And that was the one thing that I really loved about being in women's health is just like reaching out to young Black women. And I hate when they came in, you know, crying like this happened to me. I think I might have been exposed to this, to that, whatever. And like the stigma on certain things is so much bigger than what it actually is, or they think certain things. You know, I had a lot of people who thought like having herpes was going to affect their ability to have children. And so it's just things like that I think, you know, other misinformed people tell misinformed people about stuff. And then we just have this like line of like misinformation.
I think I had tagged you in something like that before. I think I had asked you something because that's another thing that we could relate on. So like oftentimes like, situations like following stupid people on social media. Not stupid, but you know, like a certain crowd. So I'm on like the live, and you know how stuff go down. They beefing, oh, so-and-so got this, so-and-so got that.
Yes.
And so people's like, well, tell the bitch to pull up her my chart. And like, it was like some allegation that somebody thought that she had like, they was accusing her of having like HSV, herpes. And so they're like, well, tell the bitch to pull it up. I'm like, for me working in the clinical, I want to educate these people. You're not going to get tested for that unless like the NP or someone finds a reason.
Yes.
It's not a part of the regular panel, okay?
Ooh, okay, I'm glad you touched on
that. For
a
STD checkup, if someone comes in just wanting routine screening, the doctor asks, do I need to like, should I examine the area? If the person says no, they don't. Like, I know for like yeast infection, BV, they will swab you, right? But the regular panel is just the G-clam. Well, they don't know what that means. Gonorrhea, chlamydia, BV, yeast, and trichomonas. You're not just getting swabbed for HSV on the regular panel. And I hate when I see that on y'all live videos of y'all being ghetto.
Yes. So, or y'all saying, I done got tested. I done already had tested. And you look and you're like, okay, yes, you got tested. This is usually men. So I'll say, you got a urine test for gonorrhea, trick, and chlamydia. You have not been tested for anything else. So you can't tell this girl that you didn't give her herpes because you've never been tested for herpes.
You've never been tested for it.
And usually, unless you have an outbreak, you don't get tested. And, you know, if you have an outbreak, they would do like a viral culture swab. But if not, they would do a blood test. You have to ask for that. So if someone tells you that you gave them herpes and you say, I've been tested already, and you've only ever been tested with a urine test, you've never been tested for herpes, so you don't know if you gave it to the person or not.
And then what else affects education is, I feel like when you go into the doctor's office, like, I think like the color makes a difference. It's kind of like, okay, say if I'm the person coming in to read them the discharge papers and I'm telling them, okay, is this still the correct pharmacy? These are the prescriptions you're picking up. Here's how you take them. I feel like if it's like a black male or like a black woman and they see that I'm black, it's like some type of embarrassment. And they blow you off so you can't properly educate them. I'm like, all right, I don't know, Walgreens on 3980 Dixie and Crum still the correct pharmacy? And I can't educate them because they're trying to blow me off like, all right, and like grab the papers and walk off. I'm trying to explain something to you, but you're letting the embarrassment get to you to where like I can't properly explain it.
Yeah. Yeah.
That's another problem.
I feel like, I've dealt with that too. Especially in women's health or when I have people sitting in my office for things that are, very private for them that they know me from social media or like they've seen me before out and about or we may know the same people. And so I usually have to have a talk with them like, hey, I know we know the same people, but here you are my patient and you are protected by law. I would never share anybody's information anyway, just me as a person. But like in healthcare, you're protected by law. So I'd usually try to when I come into those situations, I usually try to spend the first 5 minutes making them comfortable with me so that they know like, I am here for you. This is in this setting. This is what we are. And this will never leave this room. So yeah,
I don't know, like I duck and dodge. I usually give it away. Like I asked one of my MA friends, hey, can you take this room? And I don't want them to think I'm being lazy, so I explain why. I know this person, I want to take them. Can you do it? Something. Because I remember like one time I tried to avoid getting this girl, trying to avoid calling the person back. You know how you pick the charts up up front, and I end up having to call her back. I got the nastiest eye roll, but all I did was call the person back. I didn't like just so-and-so. And I'm like, dang, I hate that. Yeah. But it's like, I can't help that I work here.
It's like this is what it is. But just remember when if you ever are a patient, just remember that you're protected by law. So I do get the embarrassment. I get all of it. Don't get me wrong, but you can come up on a lot of money if anything was ever shared with anybody. So that's a lawsuit. So. But I think it sounds like you're really, really passionate about what you do and the care that you take of people. So, if you ever see her out, like she's not worried about, telling your business or anything. She really wants to help people, especially our Black community. So,
well, it's tone that gets people too that I have to like let people know. Like, how do you handle your coworkers? Like, what if you just have like a nasty coworker and you feel like her like patient care might be off?
Thank God in my current company, I do not have that. I have great coworkers. But I have had nasty coworkers. And I mean, so like when I worked labor and delivery, there was a doctor who literally shoved me in the OR. Like shoved me over. She said, move, little girl. Man. Yes. And I ended up like, that was like my last straw. And I ended up leaving the company for a little bit because I did take it to, my leadership, like, this happened. I had to leave the OR because I was like, okay, I don't feel like this is a safe environment. She's now like physically harassed me and we're in an emergency situation. Like somebody else is going to have to take over because I can't even, like that was wrong. So anyway, and nothing was done. It was kind of like, oh, you know how she is. There was this culture. Oh, that's just how she is. And that I don't go with. And at my current company, we don't do that.
That's what I'm saying. That's in healthcare, it is like that. When you keep approaching the same problem about the same person, it's just like, well,
But her patients love her and all this stuff. And I'm like, no, I don't go for that at all. I will leave here if the culture is that like certain people can do what they want because they take good care of their patients. You can't treat your nurses like crap. You can't treat your MAs like crap or your CNAs. You can't treat people like crap because at the end of the day, no matter if you have a degree higher than me or whatever, we work together. I don't work for you. Yeah. So.
That, you know what? Because I hear about that a lot. Like, when I'm like just TikToking and watching people in the field and they talk about that. Like, I don't know, like the roles, the way that you get treated based off like what role you are. That's crazy.
Yeah. It is crazy. And people still do it, but not in my company, honey. Whew. Thank you, Jesus. But that's why I've been sticking around for almost 2 years because that's like the first company that I've worked for where no matter what role you're in, you're not allowed to treat people like crap. And I stand for that and I stand on that no matter what company I'm with because at the end of the day, we both work together. We're coworkers. We work for the same company, but I don't work for you no matter if I have a degree less than you or I'm in a different role than you. Like, we're not going to sit here and do that because I'm a person and you're a person. We bleed the same blood. We, you know, we both wake up and clean our ass the same. So,
right. So have you like had because I've had patients who like, they prefer who see them. Have you like had like people do that or like experience like maybe a nurse practitioner told you they had a patient who like preferred that like oh, it's a nurse practitioner coming in, oh, I want a doctor, oh, it's a male, I want a woman. Have you had that?
yeah, I've had people who like would prefer a doctor. I mean, at my current clinic, like, if you're on the schedule for today and this is who is seeing people today, that's what you're more than welcome to like reschedule an appointment for one of the doctors. But right now today, this is who's available. So there's nothing, you know. But we do have people who are like, oh, well, I can't see a male, and it's usually culture or because of something that they've been through before, you know, like sexual assault or something like that. So we do try to accommodate that. But since it's primary care, they typically make appointments ahead of time. So if they disclose any of that information over the phone with our schedulers, they will try to accommodate that.
Do you feel like you had much more problems to resolve when you were managing like the urgent care primary?
You mean, sorry, can you ask again? You mean?
Like, I feel like it's a difference in urgent care and primary. Like, people, it's a set appointment day. It's not walk-in, so you don't have so many people like, where's the manager? These wait times are ridiculous, or like stuff like that. Do you feel like you have much more problems to accommodate in urgent care?
Yeah, I did. So I did like urgent care alternative. I worked at a retail medicine place, like inside of a grocery store. So you like by yourself. It's just you. And people would complain because it's not like two providers on. Like you're the provider for the day and it's just you. So you do have like lots of walk-ins just as you would with like urgent care. People could make appointments, but typically people are walking in. And people would be mad like, yeah, this is ridiculous. My appointment was at so-and-so. And it's like, yes, but I just walked in with somebody with shortness of breath because they had COVID. I was doing that when we were like at the peak of COVID. So it's like, yes, but I had somebody who just literally had a febrile seizure and I wasn't expecting that. And it's just me here and I have to provide quality care for them. So I get your appointment was 40 minutes ago, but like, this just came through the door and it's only me and I can only do what I can. And it's my due diligence to make sure this person gets, you know, escalated to the level of care that they need. And I have to coordinate this. I have to call the hospital. I have to stay with the patient until, you know, they get here. So, yeah.
This is like what I mean when I say like, sometimes the community just needs education on stuff that like, cause y'all get mad at people and don't even know how these fields work. It's like a common problem. People come in, why in the hell is it called urgent care, but I can't get seen immediately? Well, the problem is with it being in like urgent care, 10 people probably walked in at the same time. So when you looked online and it said a 0-minute wait time, well now it's an hour wait time. You need a primary care. And it's usually the same people who they're not gonna get a primary care.
Yeah.
Their urgent care, they think that's their doctor. Their urgent care, they think that's the emergency room.
And I had a lot of people who would come there and like I would ask them like, okay, you know, I'm seeing you for this acute visit, but like you're gonna need follow-up on this with your primary care. And they're like, well, I don't have primary care, but I really like you, so I'm gonna use you. I was not primary. I can't be your primary care. I have 15-minute visits. Like my visit slots are 15 minutes. This thing that needs to be followed up on, you need labs, you need this, you need that.
Yeah.
It's just me and my registration girl that sits out front. Like, that's all I got.
Yeah, like the community, like this is like sometimes we just have to, you just don't know. But sometimes it's important that you know because now you're giving the wrong person the attitude. Like, like coming to the urgent care and then like they refer you to the ER and you're like, well, I thought y'all could do ultrasounds here. There's no ultrasounds in the urgent care. We can get x-ray and that is it.
Yes. Yeah. And that's, you know, when people don't typically go to urgent care or urgent care alternative when they're feeling good. They usually go when they're feeling bad. So I try to have compassion at the fact that they're frustrated because they don't feel good. But yeah, a little bit of education goes a long way, and it's our job as healthcare professionals to make sure that we educate people. Some people are still going to choose to be jerks about it, and okay, what can we do? But yeah, in those settings, we're only equipped with so much. And if we tell you to go to the ER, believe us, because we're telling you we don't have the things that you're going to need for your care.
Yeah.
We don't have it.
So like, how do you feel like sometimes you like carry your problems home, like from work? Like, what I mean by that is, it's like, it's been times like I will encounter an extremely nasty person and I'm going home pissed about it. And I'm pissed because I have to keep like just maintaining my composure in all these situations and continue to be disrespected. Like, do you feel like you carry those problems home sometimes, like just pissed, like I'm sick of this?
Yeah, I'm human. Girl, I be in that car thinking of all the stuff I should have said. You know,
I know.
I'm like in the car in silence, riding in silence on my way home. Like, I should have just, but you know, you're human.
Because I feel like people, it's like what they do is like, okay, I'm going to continue to like pick with this person because I know she can't break character. She break character, and now I can make a Facebook post.
Yes.
Then I can look her up. Now I can trash her. So I'm going to pick her because she can't do nothing about it.
Yep.
The other day, a couple weeks ago, I had a patient come in. Well, like she needed a freaking drug screen. So I'm rooming people, and now I have to go get this patient, bring her back for a freaking drug screen. And so oftentimes, like, I don't know if like job fairs happen or what, but they send in this like 10 freaking drug screens. So I literally roomed a lady, went and got her next. Like, you just see me come to the waiting room and get somebody. I bring her back, and she's like, so what took so long? Did y'all like have trouble finding the cup or something? So, like, I ignore her, like, and just keep walking. You know, follow me back here to the room. Did you hear me? Like, did y'all get, like, lost or something? I waited 20 minutes, only came to pee. And I'm like, so then I have to explain my process. But it's like, I'm just so sick of having to calmly do shit. So, like, here's the process and here's what happened, yeah. Like,
yeah.
I mean, you think because I'm speaking in this white fucking voice that I'm really a white bitch.
Yeah. There's a lot to unpack there, but yes, I experienced the same thing. And, you know, sometimes I come home and I realize like that I am short tempered with the kids, or like my son is like, look, mommy, look at this. And then he jumps and does something and I'm just like,
oh, you taking your anger out
you know?
on them because of, yeah.
I mean, I don't take my anger out. I wouldn't say that, but I am just like, I have less patience. So I'm just like, you know, he'll do something and he'll be like, look at this, mommy, look what I did. And this usually kids got something stupid to show you.
Yeah.
This is what it is. And usually I'm like, okay, you're the best. You're the greatest. Where I'm like, okay, come on, let's get in the bathtub. Like, I don't have time for this.
Yeah.
You know, like, it's time to get in the bath and go to bed, because I just don't even have the mental capacity. I do not have the bandwidth to like deal with anything outside of like what we have to do and then let's go to bed, because mommy just doesn't have it. And I am honest with my kids. Like, sometimes I'll tell my son, even though he's only 6, and then my girls, they're older. So like, I'll say like, I don't have it today. Like I'm really not there today. But I think I said touched on something earlier, saying like, especially in leadership, because you're dealing with the issues of the patients, and you're also dealing with the issues that, for me, my providers, you know, their issues that they have with either processes or the patients too. So like, you're dealing with everybody's stuff. They're coming to you about it. And so like, you just have to have emotional intelligence, because you're going to, even in leadership, you still feel emotions. You feel the same emotions everybody else does, but you have to be intelligent about how you portray them. So yeah.
So that's,
it's hard. It's hard to keep your composure, because it's just like, you know, there's work me and then there's real me. And real me would have never let you do this. So just trying to stay professional and not go gangster is crazy.
So like maintaining your social media presence is like, because I feel like once you get on that platform and you're like, all right, I do this in the field, boom, that's like your audience, and that's like, now people expect that content out of you. Now people are messaging you with questions. How do you handle all that?
Okay, so what I had to do a couple months ago is put in my bio no medical advice, because I am open on my social media. I am a nurse practitioner, like, and I'll say stuff here and there or whatever. Like, and when I was in school, I documented a lot of my journey, so people knew like I was becoming a nurse practitioner. But I had people sending me stuff like blood coming from different orifices of their body and just like unwarranted like medical stuff. And so I finally just put no medical advice. Like, do not hit me up about medical advice. I can't do that anymore. Now that I have a license, I definitely can't. Like, if it's family, like, hey, I got a cold and it's been going on 10 days and it got worse. Like, I'm like, yeah, you should probably go see somebody, like, because it's probably bacterial at this point. But, like, please don't send me stuff that comes out of your vagina or, you know, like, stuff. Especially when I was in women's health.
You've got that? Oh my God. And your messages?
Yes. And I am a warm person. I would never tell anybody's business, and I do want to help, and I'm so passionate. I just think that, like, sometimes social media gives us the false, the false, what am I trying to say? Illusion that we know people for real, or that, like, people want to, like, get your vaginal discharge pictures, and, like, that's not cool to do. Yeah. Like, please don't send people that. So, like, the questions on social media, you know, if they're minor, like, hey, do you think I should go see somebody for this? Sure. But, like, I'm not going to treat you or write papers for you, like work notes and, like, stuff. Like, people have asked, yes.
What?
Like, hey, I miss where you think you could give me this doctor. Do you write doctor notes? And I'm like, what? I don't even know you. And I'm not going to do that anyway. Like, this is my license on the line. This is how I feed my family. I'd never do that.
See, this is what happens when you have a few ghetto followers.
But just, not even that. It's just people who are just, like, I don't know, to just want somebody to do them favors all the time. And it's
give
like,
you an extra off day. Are you serious?
Yeah, like, you're going to have to go see somebody. Somebody needs to assess you. I'm not doing that. Like, I'm not writing. Who knows why you took off work? I don't know. But unless you're seen in my office, I ain't writing no work notes for nothing. So, yeah, there's that. People are crazy. People are crazy. They are crazy. So, yeah. But as far as, like, social media presence, I try to, within reason, share. I always advocate that, like, you can be multidimensional. I can be professional. I can be people's boss, and I can also be drinking at the club on Saturday. Like, because I am a whole human being. Nurse practitioner or, like, healthcare is what I do. It is not who I am. So, like, I think a lot of times people get, especially in this day and age, everybody gets so caught up in image and, like, looking perfect and da 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 da. I'm like, I try to be as much as myself. Of course, I don't post, like, crazy things that could get me fired. But, like, I even put in my bio, like, my views are my own. So my company could never come for me and be like, you posted this and this is against da 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 da. I don't even have where I work. I don't even post where I work. So that's number one. And then number two, I'm allowed to be a person outside of this. Whatever I do outside of these walls, except if I do, like, drugs or something. And I'm like, whatever I do outside of these walls is me as a person. Jasmine is a whole person. She's not just nurse practitioner, supervisor.
That's me. That's me leaving here today. Like, let me watch this back. Did we say anything? No. I think we were just advocating. You know, some good. That's all it was. It wasn't that bad.
No.
Leave me alone.
Yeah. No. We didn't share anybody's information.
But yeah.
These are things that need to be talked about in healthcare. Like, these are real things that we experience, and that's okay to share that. Like,
I just like we was talking about advocating for, like, the going into schools, talking to people. That's just really what I just want to share information that people aren't aware of and, like, make them aware.
Yeah.
That's
Yes. That's what we need. People to make people aware. I feel like, I don't know if you feel the same, but just, like, after COVID, again, especially the Black community, just people have less trust in the healthcare field in general, and for good reason. There's lots of things that's happened that's, like, complete bullshit at the hands of some healthcare providers. So people just don't have a lot of trust in the healthcare system. So I feel like I want to do my part in making sure people know that there are still good people out here, and that, some of us do things out of, like, from our heart, not for the money. I mean, everybody has to make a living. So let's touch on that, because he's like, everybody goes in nurse school for the money. Nobody does any job unless you're volunteering. Everybody needs money. Have y'all seen the economy? We all need money. So, like, putting so much pressure on nurses to, like, take getting punched by patients and, like, getting kicked and yelled at and canceled and all these things by patients for the sake of just, like, because they care is crazy. Everybody needs money. So let's start there. just have compassion for people in the healthcare system and stop putting everything like as it's monetary. We all need money. Yeah, that's all I'm gonna say about that.
Yeah, I get what you're saying. I just seen somebody post something like that. She had retweeted it. They were like, you know, too many RNs these days are nasty. And she was like, or like, y'all only doing it for the aesthetic. That's what they say. Y'all only do it for the ball bags and the Stanley Cups and stuff like that. And so some girl was like, y'all just saying that now because more black women are pursuing it. You think so? The more we pursue it now, it's, oh, y'all doing it for the wrong reason.
And people can go to work and look stylish. Like, people do it every day. Like, if people want to go to work and wear figs scrubs and have Stanley Cups and bog bags, have you ever seen them? They're hard. They got the hard side, so it's easy to like keep all your stuff in place. I'm just saying. But, you know, I like when people dress up. They want to look presentable at work. Everybody doesn't have to. People are so used to nurses looking like shit.
Well, it's kind of like you come in with your hair done. Oh, shit, she here to look cute. Because my hair done, I'm here to look cute. Damn.
I want my hair done. Like, I want nice scrubs. I don't want scrubs with holes in them or scrubs that don't fit right. I want to be comfortable.
I seen something that was like, if you're like the person taking care of you don't like kind of look up the part, then why would you trust them with your care? They ain't taking care of their damn self.
Yeah. Like, why can't nurses take care of themselves or have nice things? They deserve it. And nursing is a really, really hard job. Working in healthcare is really, really hard. So, like, yeah, just saying people are doing it for the aesthetic because they had a hard day or because the patient kicked them in the face and now they are mad. Like, that's just what it is. If you went to work at Subway and somebody kicked you in the face, you wouldn't be too happy. Like, that's just what it is. So, yeah. Also, another thing I wanted to touch on real quick is that people, you know, Western medicine isn't for everybody. Pills, any kind of medicine to help with any kind of like condition, that's not for everybody. Some people like to take the more natural approach. And for minor things, the natural approach can be good. Let me know if we're good on time. But please know that prescribers are not getting kickbacks for prescribing you blood pressure medicine. Like, the company doesn't say, ooh, Jasmine prescribed 30 cases of lisinopril today, so we're going to give her $300 extra this month. That is not how that works. So please stop.
People think that?
Like, people think like they trying to give you all that medicine because they getting money because they give you all that medicine. They just want to give you all that medicine. What benefit does it do me to give you the medicine?
Okay, the opinions, stuff like that. Oh my God. Okay. Or like when you're advocating for them to test for like COVID flu, it's like y'all just want to push that on people. The results are fake anyway. The tests are fake.
Where are we gonna get from that?
All these machines are fucking lying. Who is going?
What are we gonna get? What are we gonna get from that? The companies don't reach out and say, Jasmine Jarrett, APRN, did this many tests. We're gonna send her an extra check. That's not how that works. We get paid from the companies that we work for, usually, unless you're an entrepreneur or whatever. But you get paid from the company you work for. You are not getting any kickbacks from these companies by how many medications you prescribe or how many tests you perform. It's not how that works. If we do something, it's because we saw that, based on our assessment, it was necessary for the evaluation and the treatment of you. Like, that whole mindset it really kills me.
Yeah.
Yeah. So, please, if you are one of those people, know that we make decisions based off of what we feel is best for you. We don't get any money or anything on the side from any of these companies, Pfizer or Moderna or lisinopril. None of them give us money.
Yeah. So I think we touched on like everything we did.
Yeah.
It was interesting. I'm happy that you came on.
I'm happy too. I'm glad we finally got to do this.
I can't wait to watch it back.
Me too. I can't wait. Yeah.
So, tell them where to find you.
Okay.
Do you want them to find you? If they ain't already found you? Maybe you know.
Yeah, I mean, no. It's cool. You can find me on Instagram. Yeah, I'm cool with Instagram. You can find me on Instagram. My @ name is JasmineJ_MP as a nurse practitioner. Yeah.
You know, I was going through checking out your old YouTube videos. Is they even posted still? You have a channel, but they ain't posted. No, you do have a few.
They're posted still, but I'm not as active. I just don't have time.
Yeah, you don't.
Yeah, I don't have time anymore. It was fun. It was really, really fun. I have some educational videos on my personal YouTube channel. just touching base on a few things. I think I have like 2 of them, but I don't really post as much content anymore.
See, this is why I'm glad I got to get her in person. See, I got to ask all my stuff I want to know. Yay, that's the best part about this is like having so many influential people that you follow, and then they start slacking on their media. I can just hit them up like, okay, I want to talk to you in person.
Yes, no, I love it. I'm so happy I got to do that. I love like doing stuff like this because I don't get to post as much content. It's just the editing part. It's not that I don't have the information or that I don't want to share the information. It's the editing part I ain't got time for.
See, that's why I get him to do it.
See? Okay, shout out to him.
Yep.
Yeah.
But so I think, so when I first started following her, I found you on a viral post after you graduated with the recent degree, right?
Yeah.
So then my obsession, I started following people, I dig straight into them, and now I'm obsessed. And so before I started the podcast, I had already had a lineup of everybody that I wanted to bring on. And so I reached out to her, and when she said, yeah, when I tell you, man, each episode is like a goal accomplished because these are people that like I really want to talk to, you know, versus just like some talk shows or radio shows, maybe like, I don't know, you're getting them because like your audience want them on there. Yeah. And you ain't even got nothing to say to these people. You ain't really interested. Just the audience wanted them or something.
Right.
These are like people that I genuinely want to talk to. So I'm like, I'm checking off another goal with another episode. It happened. Okay. I started it, this year? I think I came across her 2021 or 2022, and I've been plotting since. And it happened. So I can't believe it right now. And I'm like,
yes, well, I'm so happy. I'm honored that you even asked me. I really am. I'm glad we got to like discuss things. I love discussing healthcare amongst other healthcare professionals, especially in a different role, because like you see things different from I've never been an MA, so like you see things differently from your role. But yeah, I'm really, really honored, and I'm so proud of you for doing this for the people and for yourself. Like as you're going through this journey in life, like this is so important. So you can reach out to me anytime.
You know what? I just feel like some people, like, even if your goal isn't even to like make this like your brand, if you like, you know, people have stories that need to be shared. And I'm like, in the podcast community, they just want like Instagram influencers, music artists. And I'm like, it's so many people in Louisville that we could talk to that are dope. I want like everybody to come on. Yeah. So that's what it is. Yeah. It's a lot of dope people here.
It is. And, you know, I'm glad that you made this platform so that you can have those discussions with people. That I think that's great for you and your personal development, as well as like the people talking. Like, I'm learning a lot from this interaction with you. So
I can't wait. For one, I just can't wait to post these clips. It's some stuff we talked about, and I'm like, yes. Yeah. So thank you for coming on.
Yeah, thank you for having me.
All right. I don't know what to tell him. Cameron. All of this is on camera. Bloopers.
Yeah, right. This would be good for the bloopers. As I sit here awkwardly because I'm shy in real life.
Everybody just come on say that.
I am shy because I don't be going nowhere, okay? I don't go nowhere. I be at home. I mean, I go places, but I usually don't see people where the places that I go. So when I see people and they're like, I seen you at the grocery store and like you didn't say hi. And I'm like, either I didn't see you or I'm shy.
But this is different. Like, you on camera. I feel like it makes you think more about what you're saying.
Yeah, it does.
You gotta watch yourself back. Oh my God.
And I'm gonna be like, oh my God, that's crazy. Because I'm sure I done rock, like, I'm sure I rock back and forth.
You look good. You look fine.
100 times. I didn't know whether to look at the camera or look at you.
No, you did good. Okay. You did good. I'm telling you.
Okay.
Now, see, me, y'all, I'm the one who's honestly just out here winging it because, so in January, I started nursing school. So then I'm working and then nursing school. And then outside of that, I'm just at home being a mom. So, like, y'all know me. When I'm on camera with the music, I like to have myself done up. But I'm like, bruh, I got school now, so I can't work as much. So I be broke. So I'm like, I know I'm on here looking a mess. But my reasoning is the guest is who y'all looking at. And she look good.
Oh, my gosh.
Ooh, I ain't got to worry about me. I ain't got to worry about me.
Listen, it's the only way. Trying to dress up is the only way I can combat how nervous I'm going to look when you roll these clips back. I'm so nervous.
It's gonna look good. It is gonna look good. It is.
Thank you.
You gonna get a lot of new followers.
Yeah. Yeah.
Go follow. I have a whole lot of nursing students, so that's why I'm happy.
I really need to post more nursing content. I feel like I just post like personal stuff. I really need to get back into it. Soon as I get the time to edit stuff, I will post more stuff.
That's me. I feel like the moment that I slack up on posting musical content and then I go to like posting personal stuff, I get unfollowed. It's like, I just want to see this.
Yes.
And if you ain't giving them that, they gone.
They gone.
Yeah, I'm like, damn, you can't stick around.
I know. I'm like, dang, I'm more than a nurse, y'all.
Like, right.
I
Shit.
travel, I got kids.
I ain't rapping, but y'all don't want to get this podcast no chance. See, y'all not versatile enough. That's what the problem is.
Okay. And let's talk about your raps, honey.
Oh my God.
I went, you did a music video.
Was it the one I sent to you? The tribute for my nephew?
Yes.
Yeah.
Yes. Yeah. And I was like, look at her. You're so young, and to be just doing the dope things that you do, girl, you need your flowers.
Thank you.
You need your flowers. That was a great tribute. You did great.
Yeah.
Come on.
It's just so much versatility. You like, I just do so much. That's what I like. That's what keeps life interesting, for real.
Yeah, it does. You got to be versatile. People won't put you in a box.
Yeah.
Yeah, I should have touched on that, but it's cool.
You did, though. When you said, like, that ain't your personality.
Yeah, we did. We did talk about that, yeah.
Because I was going to talk about that. Like, I'd be so nervous when I go, like, and coworkers add me on Facebook, and I'm like, fuck, I'm posting these ghetto-ass rapping videos. I'm cussing. I done said nigga about 5 times in a verse. Shit, damn.
I can say that. Y'all can't.
Oh,